Good evening, everybody, and welcome to RFC Presents, a year like no other. These RFC Presents events are put on periodically by the Royal Free Charity. As many of you will know, the Royal Free Charity exists to support the work of our incredible NHS colleagues across the 3 hospitals within the Royal Free NHS Foundation Trust. My name is John Spires. I'm lucky enough to be the Chief Executive of the charity, so I get to spend my day working out what more we can do to help the patients and the staff across our hospitals. We do a number of these events and we've got more planned. It's an opportunity for you to see what goes on behind the scenes of the hospitals, to learn about perhaps some research that's going on. But today is an opportunity to take a look back at, to overuse an overused word once again, an unprecedented year. We're all very aware of what's gone on in the NHS over the past 12 months, but I think it's been particularly clear, thanks to the work of the BBC, what's been going on at the Royal Free. So I'm sure many of you are joining us because you were able to watch some of the documentary episodes of the work of our staff supporting patients in Barnet, in the Royal Free Hospital and at Chase Farm. And we've got a panel today who are made up of people who appeared in our documentary. So we're going to be joined by Caroline Clark, who's the Chief Executive of the Royal Free Group. We're going to be joined by Darren Francis, who is a surgeon, by Judy Nicol, who was a patient in the Royal Free, who was treated by Darren, and by Sarah Stanley, who works at Barnet Hospital. I'll introduce them all more properly when we get to them, but today really is an opportunity for us to hear some of those human stories about what it was like for all of us working on, working through the crisis of COVID over the past year, but also to think about what change that might mean for the NHS in future. So not just a look back, but also a look forwards to think about what lessons we've taken away from the experience, how the NHS might need to be different, and how here in the Royal Free and Barnet and Chase Farm, we might need to work differently as well. Now, crucially, the charity is a really big part of that. Many of you are supporters of the charity, and we're extremely grateful for all that you've done to support us. And we want to give you an opportunity to ask questions as well. So it will be a very informal panel discussion. I'll be posing questions to our panelists. But if you want to ask a question, you can leave a comment on the YouTube channel, or if you're on Zoom, question on the Q&A functionality in Zoom, and I'll do my very best to look at all of those and feed them through to our panelists. So to begin, I'm going to ask Caroline to kick us off. And my question for Caroline is, why did you think it was important in the midst of all of that intense pressure of last year? Why was it so important to bring in the cameras and show people what was happening within our hospitals?
Yeah, thanks, John. And actually, I was racking my brains to try and remember exactly why we'd done it. And I went back and read through a load of old board papers to try and make sure I got the answer to, because people ask me all the time, what were you thinking? Why did you think it was a good idea to bring the cameras in? And I think there are a few things. So first of all, why the Royal Free? And people might not know this, but we have a long-term experience in the management of infectious disease. So people will have heard of us during the Ebola crisis, and returning health workers from West Africa were brought to Royal Free Hospital. And we have a team of people who are world experts in dealing with diseases like COVID. So we were one of the first hospitals to receive patients. In fact, we've just had a look back our first year, so February the 9th, 2020 was when we saw our first patient with COVID. So it really has been an extraordinary year. So we knew that we were a small number of hospitals in the UK and globally, I guess, with this kind of expertise. We knew that this was an unprecedented, to use your word, event. And we knew that it was a unique situation and one that people would want to know about, and that I don't want to sound grandiose, but history will tell us lots, and it's really helpful to have somebody try and record objectively and accurately what happened. So I think there were probably 3 things that really made us make the decision. First of all, we wanted to say to the public that we were still safe and that it was still important to come back into hospital. So there was a real issue about public confidence, and we were seeing people too afraid to come into our emergency departments, and we were worried about other disease. So that was a really, really big driver. Secondly, of course, our staff actually wanted us to do it. and said they wanted us to do it. We wouldn't have done it if our staff had felt uncomfortable, and they wanted to tell the tale. And if I'm really honest, much better that you hear from people like Sarah and Darren and patients like Judy than you hear from kind of, managers like me. Much better to hear the people on the front line tell their story. And if I'm really honest, the third reason, I think, was we thought that the NHS always needs to recruit really good people. And the more you see the NHS, the more you realise what a brilliant place it is to work. It's tough and it's complicated, but actually, showing people how it works actually has helped with recruitment. So I think that was a good call. So there's three real reasons.
And I guess what we were seeing then was really the peak. It was the first wave in those first 2 episodes, and then moving into the second wave. How are things today in the hospitals as compared to that very stark picture in the documentary?
Well, the second wave that we went through in December and January and still February was we saw higher numbers than we did in that first wave. So actually, if you put 2 graphs side by side and you looked at the patients in beds now, it wouldn't look that far off that first peak, but it's lots better than it was 3 weeks ago, for example. So if I give you a couple of numbers, so we normally would have, between the Royal Free and Barnet hospitals in our intensive care units, the Royal Free would normally have 35-40 beds, and Barnet less than 20. At the very peak of when, which was about sort of that second week of January for us, the intensive care unit at the Royal Free had over 90 patients in it, and Barnet had over 30 patients in it. So we were operating at nearly 3 times our usual capacity. Today, we're operating at about 2 times our usual intensive care capacity. And it feels loads better, but I'm sure Sarah and Darren will tell you it's really, really busy, and our staff are very, very tired. And unlike in other industries where you can say let's take 2 weeks off and give everyone a massive holiday, we can't do that because the NHS doesn't stop. And I'm sure Sarah and Darren will tell you everybody wants to get back to normal working. So we're in that funny period where we want to give our staff a break. We want to make sure that we treat those patients who are still in our intensive care units well and properly, and we want to bring back some of the treatments that we've not been able to do. We've been doing loads of urgent, if you're urgently in need of surgery, you will get it, but we're not able to do some of the less urgent surgeries and less urgent treatments, and that's really frustrating for everyone. So we want to bring that back as quickly as possible. So that's kind of where we are in our cycle.
And you said how pleased staff were to have their experiences shown on the television. I think that's absolutely something we've heard at the charity as well, that staff absolutely felt it was an opportunity to show, perhaps to their families who couldn't see it, but certainly to the wider world, that some of the realities of that. And I think it played a huge part in the support that we saw, in the outpouring of love and affection for the NHS that we saw from the public, which of course has been enormously important in helping staff. Yeah. What have you particularly valued that we've been able to do thanks to that support in terms of helping our staff get through a really difficult period?
So, John, the charity has been fantastic, and we could not have done a lot of what we did without the charity. So, I know that you're here, and it's quite easy to say this to you, but I really mean it. So, we have, well, let me give you some examples. So, of course, our staff are tired, and they have had to do things in their professional lives that they were not necessarily prepared for, and it's been really, really hard. So we've been able to put in a series of support programs for staff. So be that psychological support, or be it just rest space for people to just go and kind of just relax. I was looking at some statistics earlier. So during that first wave, we people watching this may know that the Royal Free has a recreation club that the charity runs, and that recreation club today is a vaccine centre, and it's amazing. But that recreation club has also been, well, it started life as a sports hall. It was then a supermarket, and that supermarket dispensed, I think, something like 650,000 items during that first wave. That supermarket then became a vaccine centre, so it's an amazing thing in itself. But we've been able to help our staff get fed when it was harder to get fed, and we've been able to get food to our staff in all our sites where they've needed it. We've been able to help staff with accommodation and parking and all those things that take the pebbles out of people's shoes to enable them to kind of do the care that they need to. And there's always more that we can do. And actually, we've learned in this that, of course, our staff are our most valuable commodity by a massive, margin. And so, thinking through kind of the post-COVID, well, I was going to say the post-COVID world, there isn't a post-COVID world, but what happens next? And actually really thinking through what can we do for our staff. And big thank you to the charity for helping us to get this far. I think it's been amazing. And we now need to give people time and space. So magical time and space, which I think the charity will help us with.
Absolutely. And I think we've got a clip that the BBC and the production company have very kindly given us permission to share, which is possibly the most high profile clip of one of our staff, Nancy. So assuming the technology allows, can one of the team please make that clip happen? Thank you.
We are indebted to a lot of you who've left their families so far away, and you are here to help us. Please just hold on a little bit more. We shall overcome this. And when we do, the NHS hopefully will be the better for it. So I am truly grateful. I am proud to be a nurse. Thank you. I am truly grateful.
Thank you. A great clip there. And of course, reinforcing that sometimes our staff themselves were patients. And on the point of both staff and patients, I'd like to bring in our other panelists. So I'd like to bring in Sarah, Darren and Judy. This is an opportunity for us to hear another story about that was featured in the hospital documentary. So the story of Judy's cancer treatment under the watchful eye of Darren. Before I do that, though, maybe if I could invite Judy, you first of all, just to briefly tell us your story and why you decided to be part of the documentary.
I'm still asking myself that question sometimes, but obviously I had quite a serious condition. I had cancer in 2 areas of my intestine tract, and I was approached asking if I would take part. And I really felt as though I did want to do it. I'm normally really a very shy person. I never have my photo taken. I felt as though I wanted to do it because it did feel like the NHS was shut for a while unless you had COVID. And I thought if it makes one other person go to the doctor because they've got dodgy symptoms, then it would be worthwhile me taking part, which is why I said that I would do that. But yes, so I had my operation in September, as the programme showed, and I had started to recover from that and was feeling great. Then I started chemo, so I'm not great at the moment. I'm cycle 7 of 12, so close to the end now.
Well done. And Darren, perhaps I can ask you as well. What was the experience like for you, with your work being seen, and that experience of treating patients at such a hard time being seen by so many people?
I was fortunate enough to stumble upon the first episodes which came out. And in fact, my accountant Stanley was one of the main characters, and I was so impressed with how the production team, the hospital, and how realistic and what a great message it was, that I was delighted that I could be involved and was happy with the film team. And then Judy's story became such a touching story when we came out of COVID, that it was something. There's a little bit of a life event from a personal point of view to be involved in a project which came across so well and reflected so realistically what was happening within the hospital. And I felt that for the first run of the first series during COVID, and I didn't get to see the episodes until they came out. And then I was delighted with how it came out, and I just think it did so much good. The messages I got, not about me, but about how the hospital was getting back on its feet after COVID, the message it was given about how tough it was during COVID, the message about how everyone had come together during COVID. And you don't want to be grandiose or over dramatic, but television's a platform for drama. And the production team were fabulous, but the drama was all there because it was dramatic. And to a bit like what Judy says, to get that message across, or to be part of a project which was a little bit different to what I would normally do, as in the TV side of things, working with different people who are extremely professional and did their job so well when they were, and so respectfully well when they were within the hospital. To be part of that was a privilege. To be part of the whole COVID generation, and I've said this to the junior doctors, in a way you'll look back on this, and although you haven't had so much experience at certain things, you've been part of an unprecedented time which you would have learned so much from. And for the public to see it, to see what it was like at all levels, from managerial, from nursing, from cleaners to patients, I thought it was tremendous. And like I said, it was a privilege to be involved with it.
And Sarah, how about you? I'm guessing for you, but quite similar sentiments, but what was that feeling like for you being featured in the programme?
Thanks, John. I've got quite an unusual role in that I am a consultant nurse who specialises in patients needing to go to intensive care who are outside of it, and do that 50% of my time. And then the other 50%, I'm a divisional director, the first nurse divisional director for medicine and urgent care at Barnet, which covers the emergency department, all of the wards, and respiratory, which ended up being a very important specialty in managing COVID outside of intensive care. So for me, being part of the programme, I want to echo, I found them the most fantastic group of people, actually, and we became good friends alongside them. And I think we felt very natural in being able to feel open and honest about what was going on. So there was never a worry about what you were saying or what you were doing on the screen. And I felt that they did reflect exactly what was going on. I think it's a shame we almost finished the last episode just as we went into almost the worst surge in the December-January period. We were sort of just about starting to get there again in the sort of second series, the 6 episodes. But I was delighted to be part of it because the village that I live in, at that time, hardly anyone had had COVID. Nobody seemed to be affected, apart from obviously having to do homeschooling and being stuck at home. And I think a lot of people kept thinking, what's all this fuss about? I don't understand kind of what's going on. And I think the programme really showed the true reality. As Darren said, the drama was all there in the stories, the beautiful storytelling of the patients and the staff, and how we're sort of all in this together. And the magic of miracles is because humans manage to find some way to look after each other, and staff find it in them to look after them. And I think that did come across beautifully in nearly all of the episodes. So I'm delighted that we part. I really miss them. I keep still looking that I had a microphone tucked in my scrubs the whole time. And that's now gone, but I'm delighted we did it, and I think we should do more of this.
Thanks, Sarah. And I think we've got one more clip again, if the technology allows, which is probably very well known to those of you that watch the documentary, but it's Judy. It's part of Judy and Darren's story from that episode.
Chase Farm in Enfield is one of the Royal Free London's 3 hospitals.
Do you want to do me?
Yeah, gonna change this.
No.
Colorectal surgeon Darren Francis is here to meet one of his highest priority cancer patients, 50-year-old Judy.
Yeah, please come in.
Hello.
Hello, nice to meet you.
Darren.
I'm Darren. I would shake your hand, but we're not allowed to. Yeah, we don't do that anymore. So we spoke on the phone, didn't we?
We did.
So the plan is for me to have a look at the bowel and to see what part of the bowel I can spare.
Oh.
Okay, as in I'd plan to remove all of it, where the tumour here, coming round to the tumour here. At the moment, I think our priorities is your safety and getting the tumours out. And I'll give you a buzz.
Judy first had bowel cancer 11 years ago. In July, she was told the cancer had returned. COVID restrictions caused a 3-month wait for a diagnosis at her local hospital.
The waiting is the hardest thing. I have been isolating pretty much since I had my diagnosis. The wait has been a killer. I can't go and see my friends and offload, and I can't see my family.
So Judy, obviously, I think a huge number of people were really moved by that story. It was one of the ones that was repeatedly shared on Twitter, and lots of people commenting on you know how inspiring in some ways they found that, but also how difficult that must have been for you. And I think we, you know, on behalf of all of us, want to say a huge thank you, not just for taking part in the programme, but also for joining us tonight. What memories, looking back at that again, what memories do you have of that time, and the strangeness of having to be treated during a period where COVID was so all-consuming?
Yeah, it was certainly a different time compared to the time that I had cancer 11 years ago. I had lots of support from friends and family and lots of visitors from friends and family then. Obviously, this time there was none of that. However, I did feel supremely safe in the hospital. Everybody that treated me and looked after me made me feel very, very calm, and COVID didn't really come into my head in the period of time that I was in hospital. The thing that struck me most, though, was I felt comfortable and secure. Aaron and his colleagues were going to take good care of me. It was only really when I watched that documentary, I saw the layperson, I saw the struggle everybody went through to get me into that operating theatre, and I can't tell you how grateful I am that I had my operation on the day that I was promised, because it seemed after watching that was quite precarious, and I hadn't realised that, because it was like Aaron and all his colleagues were like a swan, really calm, but clearly underneath the water they were flapping around and panicking, and it just make the patients feel safe and secure. And I know, unfortunately, some people are disappointed, but you know, they do their hardest to make sure that everybody gets treated as and when they need to be. And I'm getting quite emotional, actually, because it takes me back to that time, which was quite a difficult time. And I can't tell you how grateful I am to all of the people that were involved in my care.
Absolutely.
Sorry.
No, don't apologise at all. And Darren, what was that like for you? Because I think we really saw that absolutely, as Judy says, that challenge of trying to make sure everything is there to make sure these complex operations can go ahead. How did that impact on you as a treating clinician?
At the time, it's a bit like what Judy says. You're paddling underneath, and you're trying to remain calm and do your job. But I think when you reflect on it, which we've had an opportunity to do since the programme and since COVID, you try and reflect and think, well, what are the take-home messages of trying to work during those things? And I think Caroline alluded to it at the beginning. I think the management team and people like yourselves, charities, realise that you can't really care for others unless you're caring for yourself as well. And I think we were very well looked after, considering the situation. And I think that's an important thing to reflect on, because it is tough, but for it to be recognised by organisations like yourself, by senior management, and to feel that you're being looked after helps you massively to look after other people, massively. I think the other thing when you reflect on it is rank. It's always been a very hierarchical system in hospital medicine. You know, I've been in it 20, 21, 22 years. But during this pandemic, rank didn't seem to matter, you know, and it's not to sound once again too romantic, but it didn't. Everyone was just in there doing what they could do for everyone. And I think the leadership reflected that in how teams were dispersed across the hospital. Everyone just got on with it, from the very, very top in management to the very, very to the man in Costa, you know, that gets our coffees. And then it's not always what you do, because you're trained to do a certain thing. That's what you do, but it's how you do it. It's how you do it. And during a pandemic, it really, really does test you how you deliver what you're meant to be delivering, because you don't have all the resource there available. So I think they're the three sort of lessons learned. And I generally think that the trust organisations like yourself really looked after the staff during this time and appreciated what was going on. And you know, you think that's a given, but none of that's a given. Looking after people it isn't a given. It takes certain people, certain personalities, and it gives you faith in human nature again. It does, and the rest of it, doing the operation and doing the rest, that's what you do, you know. But it's the paddling underneath which Judy alludes to, which was really helped, and you had your armbands on, which was the hospital helping you, and the rubbering on helping you keep your head afloat, and with all that sort of help and support, you know, you got through it.
Absolutely. And I mean, one of the areas that Caroline and I talk about an awful lot, and I'm sure will for a very long time, is the need for that psychological support. So recognizing the mental health impact of the pandemic on NHS staff at all levels, as you say, you know, right from porters and staff working in the mortuary right up through to senior management. Caroline, I wonder if you could talk to where you think longer term, where you think that support might need to be either to continue or where we might need to improve those things, because that's something that the charity and the trust have been very much doing hand in glove.
Yeah, well, so I talked about kind of the gift of time and the gift of space, and I think it's probably, you know, so creating time for people to decompress. And this isn't something that's going to, you know, this isn't something that people necessarily going to bounce back from in the next couple of months. This is something that's going to take our generation of health workers longer to really come to terms with. And so everybody will do it in their own different way, and different people will need different things. So the first thing, I suppose, is we're going to have to think of lots and lots of different ways to kind of help people decompress. And then the second thing that I've become really, really aware of is we need more space, right? We just haven't got enough space. So the hospitals feel quite squashed sometimes, and there isn't necessarily enough room for people to go and have a break in a distant way where you can kind of observe infection control guidelines and all that. And so actually, you know, the gift of time and the gift of space are probably the things that we need. And the charity actually did help us on I'm just thinking we've got some really nice restrooms now on the intensive care unit on the Royal Free site, and we've got restrooms, I think 11 or so, that you helped us put in over the rest of the hospitals. But we're going to need more of that, because actually people, you know, and it's this thing of, we forget that sitting down and just chatting to your colleagues is kind of one of the best things that you can do. And if we don't give you the space to do it, or we expect you to do it in a really crowded office, that's not going to be how it is. And for anybody that's visited a hospital recently, lots and lots of the changes that we made during the pandemic are here to stay. So, you know, I think mask wearing will be with us for a long time. I think, you know, one-way systems and just spacious seating areas are things that will just be here to stay, and that's good. And, you know, hospitals in other parts of the world have been doing that for a long time. And I think, you know, that's a good thing, but we're going to need to do more of it.
And Sarah, from your perspective, particularly as someone who I know has got a very strong interest in digital health, what lessons do you think we might be able to take away from the things that we have done in order to keep care going through all of this? So what ways do you see the NHS perhaps changing, and how do we make sure that we support staff across the NHS to be able to do that effectively?
I think it's been Cerner has been absolutely fantastic for us at Barnet, and you know, it's coming to the Royal Free, but it has made our decision making unbelievably slick and fast, and we have a clinical huddle on a daily basis where we have the patient list of COVID patients up, intensive care, ourselves, medics are there, and we're able to see the radiological scans and imaging, and we're able to make decisions about the right treatments for patients, and any research projects they could get access to. We can discuss 30 patients in about 30 minutes. And we've decided that it's brilliant, and we keep it for non-COVID patients as well, because actually you've got a really good group of clinicians there, and you've got the digital enablement with the Cerner. I think Streams also is great in terms of any sort of push notifications, so telling us that somebody is unwell and thinking about other ways we can use that parameter. And you could be then remote working and monitoring people virtually. We've also now got a COVID virtual clinic. So we've got a clinic of about 100 patients out in the community that are COVID positive, but don't need to be in hospital, but we're worried they might get sicker. So we have a way of monitoring them on a daily basis, 3 times daily basis. Somebody checks in with them, and if they are getting sicker, they can come back into hospital. So I think the learning from the first wave and the second wave is phenomenal, and also processing data quickly as opposed to big audits on paper is another thing. I think you're talking about the staff and how they feel. So I think all of my colleagues and myself we've all had sleepless nights where we've worried about, are the decisions we made the right ones? Did we take the right people to intensive care at the right time? And I think something about debriefing and processing that information and having the data to show us as a group, but also nationally and internationally, is key in terms of us feeling like, not only do we feel like we did the right thing, we did do the right thing, or the learning shows us this is what we would do in the future. And certainly from the first wave to the second wave, the treatments we used were phenomenally different. The equipment that we used was different. So even in a very short space of time, we were able to make massive changes to our treatment for COVID patients. It did mean they were still in hospital, which came with its challenges. But I think in the future, the more treatments we have, we may be able to manage COVID in different ways, and certainly shorten lengths of stay in hospital. So I think most clinicians want to know what they did was okay, and they did the right things. And if it wasn't the right things, we've learned what the right things would be, because we're treating a new disease that not a single person had a clue how to treat less than a year ago. And now we are running COVID clinics and virtual clinics and all sorts of things. So I think the speed and pace at which we've done things is also phenomenal, and that learning shouldn't go. So we've made an HDU for COVID in less than a week that's running 24 hours a day with fantastic links with intensive care. We've made virtual clinics with GPs because we can't run our outpatients in the same way. And I'm not sure we'll necessarily go back, because I think there are lots of different ways of working virtually, digitally, which are really useful. So whilst it's been horrendous in one way, there's always learning and improvements that probably will come out of this. So I think the speed of change has definitely accelerated for me. And the other area that we absolutely wanted to go into but could do at a much greater pace is integrating, particularly into the community setting. So having a lot more joined up working that we've always wanted to do, but this has really pushed us into having to do it. And we've done it within a day or two, not lots of meetings, not lots of discussions and worrying about who's paying for what. We've just done it and it's worked. So I think, that there will be a lot of learning and lots of things that there would be no reason to go back. This is better.
And Sarah, I know you're not a fatigue specialist, but we've got a question on from one of our audience about long COVID, which is something that the charity certainly gets asked an awful lot about, and we're certainly interested to know how we and the trust can sort of work together to understand that better. How do you think we can take lessons from long COVID, because I think it's an increasingly research active area, and apply those to that much broader community of people with ME, for example, or chronic fatigue syndrome? Is that an area that you think the Royal Free has got an opportunity to build on and to be part of that research effort?
Absolutely, and I actually think all long-term conditions could be managed in different ways that are not just hospital-based, that are community-based, and actually getting the shared learning and understanding. And it's not just about the medical model, it is about all of the human factors, it's about social connections, it's about what perhaps charities could do in the community, all to help manage complex long-term conditions. A lot of it is around how you actually feel, not what medication we can necessarily give you. And I think there's so much more joined up work we could do with mixing social and clinical care together, and also the patient being at the front of it, leading it, deciding what things they need. I think we as clinicians often think we know the answer, and sometimes we don't. And it's much better to have a more partnership approach to how we can manage these types of conditions and learn together.
And Judy, I don't know what experience you've had of having to work with your doctors and nurses in a different way, whether that's been virtual or but obviously you'd had a cancer experience years before. How different did it feel for you? And do you think there are lessons we can take away from that could help cancer patients in the future?
Yeah, I do think it is different having telephone consultations rather than face to face. Actually, in a way, when it's a down day and it's a difficult day and I've just had some chemo, it's quite a good thing to have a telephone consultation rather than having to drive to the hospital and see, wait for some minutes and then have a consultation and then drive home again. So actually, I think there is a place going forward for telephone consultations. It's a totally different area, but I work within a school, and much to my son's disappointment, I told him last week that there probably will never be another school snow day, because now we have remote learning up and running. Much to his distress, he realised that probably there'll never be another snow day, because if he's going to be at home, he's going to be working. And I think that probably reflects across all walks of life, and maybe there won't be so much need for people to go into hospitals anymore when they can perhaps have a telephone consultation. Obviously, face-to-face consultations are always going to be a necessary part, aren't they? But I think it will change. I think lots of things will change for all of us moving forward.
And Darren, what, as a working clinician, what do you think might need to change in terms of the way that we train and support our doctors and nurses if the NHS is going to change so markedly in the years to come, which I think everyone feels like it probably will?
I think we've been moving towards these times of reflection and thinking back on what we've learned and what we've done well and what we haven't done so well. And there's been a general movement towards that before COVID. And I think, like Sarah mentioned, the COVID pandemic sped that process up. And I think we had something called Schwartz rounds a while ago, maybe about 5 years ago, which some people engaged with. They were rounds where people could reflect about problems they'd had at work or not had at work, reflect on the job they're doing, how well they're doing it. And I just think the COVID pandemic has allowed us to maybe break down some barriers between different ranks of people within hospitals, so that people can work for a common purpose. And I think people will be more receptive. People will be able to take other people's ideas. And I just think it's going to be more about reflection and sort of, look how we did during the COVID when we worked together to deliver we did amazingly well. No one had ever come across something like this ever before. Everyone was up against it. And to deliver the care, I think that we delivered. Of course, you can do better. You can always do better on reflection. But to manage what we did as a group of people within an organisation, I think was tremendous. And I think it got the applause it deserved. But moving on, you can't forget about how people work together to get through a pandemic. Not every day is going to be a pandemic, thank God. But you've got to try and take that experience of working together sort of against the odds. And even if you take a small piece of that to put into, in inverted commas, normal life, post-COVID, whatever that is, then that'll be a real positive from the pandemic. Whether it be technology, whether it be teamwork, whether it be reflection, whether it be all those little bits, a little bit of everything. And it's got to be a positive to move forward as an organisation. The Royal Free, the NHS, the whole delivery of healthcare.
And Caroline, what role do you see for the charity in helping you to capitalise on those big things and small things that Darren was talking about, so that we do take the stuff that we've learned and apply it effectively?
So I think there's a couple of things, aren't there? So the charity has been great in helping us harness a lot of the goodwill and generosity of kind of local communities. And actually, I'm sure there are people watching this that we should say thank you to, because actually we saw an immense sort of outpouring of goodwill and generosity during the last 12 months. And that really, really helped us. So there's a sort of galvanizing effect of what we've just been through. We need, it's well known, isn't it? The NHS is not cash rich. So we are going to need to dig very deep into our pockets over the next kind of 5 to 10 years to really kind of make sure that we capitalize on some of the lessons we've just been describing, make sure that we can get as 21st century around kind of digital technology, the stuff that Sarah and Judy have been talking about. And also then, anyone that's walked around bits of our estate will know that, it's not as modern as it could be, and there's lots we need to do. So we talked earlier about, we need to create some more space for our staff just to kind of rest in and decompress. But, we also need to create some more space to deliver some of our services, particularly given that we're going to need more space. So you may not know this, John, but we are one of the biggest cancer centres in the UK. We see a phenomenal number of patients in diagnosing and treating cancer services. And we'd really like to make the infrastructure for those patients better, and we've learned lots over the last 12 months. So, I very much hope the charity will be able to help us with some of those big projects. Similarly, we run an enormous heart attack centre, and we have some of the most splendid cardiac services. But again, we'd like to, so there are lots of these kind of sort of big service specific things, which actually, we would really, our pockets aren't deep enough. But actually, what we, I suppose, and if you think, we've really, really enjoyed working with the charity to build the Institute for Immunity and Transplantation, the Pears building. And we're really, really excited that's going to open this year. It's brilliant. So, the thing for me is and of course, everybody is really interested in immunology now, aren't they? So isn't that, a serendipitous thing that, but truly the research that we're going to do in that building will genuinely be, globally important and important to people locally, and things that people want to get involved in. So I suppose the thing for me about working with a charity now is what next? How do we make sure that's as brilliant as it can be? And then think about, the research that comes next. And you asked a question about long COVID earlier, and I was thinking, gosh, one of the things we really need to do is make sure that all the research we do around these conditions, we do it together. So we do it around UCL, who are our academic partner, and we make sure that we're aligning everything so that we can kind of, attract more and more interest in and get more patients involved in trials and so on. So I think, you'll hear me working much more in partnership with other organisations in North London and across London in order to make some of that happen. Sorry, long answer. I've got a really, really long list if you want it, but I'll probably give it to you later.
Thank you. And we've got a couple of comments that I'm going to join together, one from Jenny and one from Philippa. Really just, I guess, talking about adaptation. So talking about what are we going to do differently? And maybe if I can ask each of you as we draw this session to a close, what's one thing that you are going to do differently as a result of the experience of the past year, whether it might be a work thing or a personal thing? Maybe Sarah, if I put you on the spot and ask you to go first, what one thing will you do differently?
I think one thing I do differently with work is just, I think Darren's raised it, I think we've got to have a shared focus. And once we've got the shared focus, which is probably around the health of our population, which involves anything from, having vaccines to actually managing conditions and seeing it in a different way, rather than seeing you as a hospital patient or as a GP patient, actually seeing it completely differently. So I think approaching it with a shared focus for all of us gets us the same focus we had with COVID. And once you start from that position, you start to view things in a different way. So lots more joined up working. And on a personal note, I definitely think it's made me think about things that are really important in life, and valuing things valuing a drive in the countryside when the autumn leaves are changing colour, and kind of focusing on more simpler things than always worrying about the bigger things. So, and it's down to humans and people and friends and family and patients and staff. It's the simple things that make all the difference. So thank you.
Absolutely. Great message for us all. Darren, how about you? What's one thing you will take away from this experience and do differently?
There's lots and lots, but I think to sit down and reflect on what you've done each day. During COVID, you had no real time for reflection. It's now, hopefully in the forthcoming months, that you've got time. But reflect on the good things you've done and reflect on the bad things you've done, and be able to change things. And one other thing is just treat people like you'd want to be treated. It's so simple. It's so simple. And when you see someone without visitors, without a newspaper, just get them a newspaper. It's those sort of. It's such a simple thing. If you're lying in a bed with no one to visit you all day long, no one cares about you. Well, obviously, do your observations, your scans, your whatever. All you want is to talk to someone or read a paper. And it's like Sarah said, these simple things matter so much. And if that can be included in your reflection, then you'll be a better person. And by that, the people within the organisations will be better people, the organisation will be better, and society will be better.
Thanks, Darren. And Judy, how about you? What's one thing that you've taken away from the past year?
I think it is to value friends and family. A lot of people reached out to me after a lot of people I knew reached out to me after they saw the programme on the television. And there's so many people walking a difficult road in lockdown, and you think you've got it bad, but actually there's other people that are really struggling as well, and reaching out to other people and being there for other people, which is why it's so important to look after our NHS staff, actually, because they look after us, and without that support we're stuffed, really.
Thank you, Judy, and obviously good luck from all of us for the rest of your treatment. And all that's left for me to say is a huge thank you to all of our panelists, to Judy, to Darren, to Sarah, and to Caroline. Thank you to all of you who've joined us today to hear these stories. And many of you I know are very long-term supporters of the charity, and we are extremely grateful for all that you do to allow us to carry on supporting our patients and our staff. And I think we'll leave it there. Thank you very much, everyone, and good evening.
Thank you. Thank you.
Thank you.